So I got dropped from my health insurance plan when I turned 26. I was on my mother's plan for my whole life. She still works for a public school system, so she has great benefits. Now I only work part-time because there's certain rules and regulations that lawyers and law students have to abide by. And one of those rules is that while you're attending law school full-time, you can also work full-time. And if I can't work full-time, then I can't get medical coverage through my job. My name is Chris LoGalbo, and I currently attend law school full-time, Brooklyn Law in the evenings, and I also work during the day at an investment firm. I do what I do because ever since I was a little kid, I always wanted to be one of those trial lawyers that represented the people that no one else wanted to represent. So that's my dream, and that's what I'm doing. I try to always eat healthy, which is something I could do no matter how busy I am. But I guess that in order to be healthy and to really be fit, it takes time, and time is something that I don't really have at this point in my life. You know, if I have to wake up at 7 o'clock and go to work from 7 to 5 and then go from class from 6 to 9, I really can only go to the gym or, you know, try to exercise either before work or after class. And, you know, I try to do it when I can, but I don't necessarily always have time for that. So I do try to always eat healthy, but as far as exercise goes, I do it when I can, but it's not much, no. If I were to get sick and be out of work for a month or just be unable to go to class for a month, it would definitely have an adverse effect on my career and my studies. I mean, starting with work, you know, I work on an hourly basis, week by week, so I don't necessarily have a set schedule. If I get sick and I'm out of work, that means that I'm out of a paycheck, which ultimately means that I'm going to have to find some type of ulterior way to pay the bills and you know, make it through. As far as going to class goes, if I can't go to class, then I can't graduate on time if I can't take the bar exam this summer. So really, if I get sick, I'd be in a pretty tough spot. You know, my finances are managed to this point where I need every day, I need every hour. You know, I also have to plan for certain periods of time where I'm not necessarily going to be able to work, like studying for the bar exam or studying for final exams. So if I were to be out of work for a month or, you know, unable to go in, I'd definitely be in a tough spot. Not having health insurance has definitely changed the way I think about things. I mean, I used to be an avid cyclist, and then when I first got dropped from my health insurance plan, I don't even keep the bike in my apartment anymore, because I know that if I hop on the bike, there's a chance that I'm going to fall off, and if there's a chance that I fall off, I could potentially break an arm, and I don't know where the money to pay for those medical bills is going to come from. I mean, even things as simple as walking down the street. I mean, I used to wait on the curb. Now I stand back a little bit and I don't cross the street before that light turns white. So, you know, it's definitely changed the way that I go about, you know, my work day to day. I stay away from people at work that are sick. You know, if I hear someone coughing on a train, I get off and go to the next car. Those are definitely things that I didn't do when I had health insurance. So it definitely changes the way that you think. It makes you constantly be concerned, because you have this thought in the back of your mind where even if you need something as simple as an antibiotic, I mean, not even breaking a bone, something as simple as having a sinus infection, I mean, that could really be a big burden on me without having health insurance. I mean, just the doctor visit alone is hundreds of dollars, you know, and then the bill for the medicine, whatever that may be. So it's constantly a concern. It's always something that I'm thinking about. You know, am I going to get sick? You know, am I going to get hurt? It's definitely a fear that I have without being covered. I haven't made the decision to get health insurance because, I mean, really it's an expense issue, you know. I'm trying to work as much as I possibly can to make ends meet at this point in my life. You know, I make too much to qualify for some type of state-funded program, but I don't necessarily make enough for me to go out of pocket right now on a massive expense for some, you know, comprehensive plan. So, you know, while time is an issue, I would say ultimately my decision to not get health insurance at this point has been more of an expense concern than time. I mean, I guess it's definitely upsetting not being covered, you know what I mean? Like I said, there's certain parts of my life that I really miss. I don't play football anymore. I don't even, you know, run down the block anymore. I don't ride my bike anymore. And I really miss those things. They're definitely parts of my life that I miss having. And, you know, if I had coverage, I'd definitely, you know, be more willing to enjoy those parts of my life again.